Good evening and greetings to everybody. Welcome to Head to Toe with Dr. Tebelele. Thank you for joining us once again. Remember, wherever you are, you can always watch us in your car or taking a walk. Free Vision Play. That is the app, and the link is provided on all our socials. We're talking a very nice topic today, and we're looking into people who are planning pregnancy and then journeying with pregnancy. With through the eyes and brain of Dr. Siva Pillay. Dr. Siva, can you just greet and introduce yourself to our viewers?
Good evening to all the viewers, and it's an honor and a pleasure to be here, to be invited by Dr. Tebelele. Pregnancy and antenatal care is a big topic, but I'm hoping we will be able to cover what is needed.
Thank you very much, Siva. I know you're a very busy man. Thank you for honoring us, and thank you for empowering our communities. It's not only people who have got nothing to do with health, but even health professionals are watching. So try to be simple and focused. Make sure that everyone gains something. Firstly, let's start at, it's very important to make sure that when we're planning or plotting pregnancy, the soil that we're going to plant this seed on is ready and is going to make sure that we grow something that's going to be healthy. How important is that in terms of pregnancy? Dr. Siva is very much deep into obstetrics.
Dr. Tebelele, you've hit the nail on the head. You know, all mothers come to us when they are pregnant. And I could just dream and wish if mothers can come to us before they are pregnant. You know, there's a thing called Barker's hypothesis. Barker's hypothesis says what happens within the womb will reflect what happens to you as an adult in an adult life. And many of the things that we see now in people could have been prevented had we prevented these things from happening in the first place. Now, preconceptual care, that is before you fall pregnant, is the most important thing. It is more important than coming to see me when you are pregnant.
When you're already pregnant, yes.
Yayazi nje imbewu awuzukhula. You know, it will never grow
Yes,
if the soil is
umhlaba
not
ukho
fertile,
right.
as you said. So I want, if I can succeed today in convincing people that pregnancy is not a 9 months affair, but it's more than a 12-month affair. And it includes the fathers. Then I have succeeded. It was worth my while to come and sit here today.
That's very critical, Siva, because fathers think they just throw the seed and then they withdraw and so on. In fact, some of these things are cultural and then there are stereotypes and so on. It's like, uzawumata, uba ukapha umuntu oyohlukudla and whatever.
So it's so important. So preconceptual care is a concept to say, how do we check that this mother is ready? You see, we want to move from saving mothers, saving babies, or healthy mother, healthy baby, to say, can we have a healthy woman first? And that woman will make a healthy and productive mother, and that will have a healthy child. If Now, why? People will ask, why do I need to come early? There are hundreds of things that you can do before you fall pregnant.
Can you kindly mention them so that people understand?
It's so important. First thing first, if you are smoking, you need to stop smoking because it's a bad thing for the fetus. It affects the blood flow, it's other things. If you are taking drugs, you need to stop. If you have got infections, it's so important to know whether you are having these infections and we treat them before you fall pregnant. Yes. You know, then they come to us, then this is the first time they're finding out they are HIV and they are 6 months pregnant. And already, you know, and it's too late. If you do it beforehand, it's better. The next thing, many people today, 30% of the population that are in the childbearing age, they are actually ill. They are taking treatment. They are either taking treatment for diabetes, high blood pressure, thyroid, chronic and everything like that. Now, if you don't optimize that treatment and you don't change the treatment for what is pregnancy, you're going to be in as well. The important thing is that many of the medicines that you normally use for yourself, for your health, is not good when you fall pregnant. Masiti, you have got diabetes.
Yeah.
All the oral drugs that you take, except metformin, they are going to affect your baby.
So it means if you are diabetic and planning to fall pregnant, your treatment must be adjusted to suit someone who
wants to fall pregnant. Second thing, you need to go and check your eyes and check that you don't have diabetic retinopathy. If you have diabetic retinopathic and you fall pregnant, 50% you can go blind.
Yo.
And people don't know this. And I've had young people, 30, 32 years old, in my surgery. After this, they are diabetes, taking insulin, and they didn't optimize themselves. Next thing, they are blind. People do not know that they have thyroid disease, so they need to look at it. Hyperthyroidism, any of the thyroid disorders affect pregnancies and affect miscarriages. In fact, one of the things we need to tell people, 20% of all pregnancies ends in miscarriage. And the ladies don't talk about it. Only when you tell a lady...
It's 30%.
20%.
20%.
1 in 5.
Okay.
And when you go and tell a lady, no, I have had a miscarriage, then they will tell you, no, I had one too. And
In fact,
it's
women have got a tendency of thinking that miscarriage is their fault.
It's their fault. It's not.
They tend to own it and get depressed and everything.
But if I had to tell you that if you do pre-planning, so much of that can be prevented. And there is methods now to prevent it. The second thing, our state services is not up to par. When you have a miscarriage, we should investigate. What is the reason that I had a miscarriage? We just say, it's normal, something must be wrong with your baby. But 30% of all miscarriages, you can find a reason. And if you treat that, you can prevent a next miscarriage.
Yes.
And next thing you see people come to us and say, I've got 2 miscarriages, I've got 3 miscarriages. Now the government will say to you, only when you have had 3 miscarriages, then I can investigate you. You know how depressing that is for a mother? It is absolutely devastating. In fact, when you have your first miscarriage, you should be investigated and look at how you can prevent it. Now, medication substitution. So many medications that we take for different conditions, even over-the-counter medications, they are not safe in pregnancy.
In pregnancy, yeah.
And you have to inform patients what to take. So if you're deciding to fall pregnant, you need to consult your doctor, pharmacist, and others to ask, is this medicine safe if I fall pregnant? Now the people come and say to you, I see Erlinghoek, I'll come to you when I'm 3 months.
Yes.
Remember, the brain is forming in 5 to 6 weeks.
Yes.
The heart is forming 5 to 6 weeks. The lungs, the limbs and all, they are forming by 6 weeks. When you miss your period, you're already 2 weeks pregnant. Then you're coming to see me after that. Already your baby is growing. The process is going on. And therefore it is important for you to come in. Now, a high statistics in South Africa is that 60% of our pregnancies have one or other complication. And if you look at it, most of it could have been prevented. We have preterm births, which is preventable. We have people who are having high blood pressure, or PET as you call it, It is preventable. Today, if nothing else, I must teach people how to prevent PET. And we can look at preterm labor, because the NICU, 1 day in NICU is so expensive for the government. But if you look at the cervix, you can do prediction. You can see which person is predisposed to premature labor and preterm labor, and you can prevent these things. So therefore, preventative and promotive care is so important, and being proactive and doing preconceptual care is important. Now there are many drugs, and one of the drugs I want to tell people about is this Roaccutane. People, they have pimples.
Oh, Roaccutane for acne. Let me pause you there, Siva, because Roaccutane is, lots of people are using Roaccutane now, and yet it's got so many side effects, so it needs to be done under monitoring. But pregnancy is definitely prohibited if you're using Roaccutane.
If you use Roaccutane, pregnancy is prohibited for 18 months.
18 months?
So if in between that 18 months, there is a big chance that your baby is affected. Second thing, immunization.
Before you go to the second thing, let's just hold there. We'll take a short break and then we'll be back. Our viewers, thank you for sitting on your screen. Prenatal preparation, that is before the pregnancy sets in. You prepare the ground. Look at the medication you are taking, everything. You sort everything out to prevent and make sure that the outcomes are going to be good. We'll be back shortly with Dr. Siva Pillay, journey with you through pregnancy. Welcome and thank you for sticking to your screen. Pumakaba V. Don't forget to follow us and Pumakaba TV on all socials, TikTok, Instagram, Facebook, and also our Pillay Communications. We're discussing the journey of pregnancy tonight with Dr. Siva Pillay, who's very much deep and well educated when it comes to obstetrics. That is his special interest and has done a lot and is also doing a lot of imaging and so on. Is equipping us, preparing to fall pregnant. Now we're into the pregnancy. These people have now conceived. What should we do?
So when
for
people
safety?
are pregnant, we advise them, please go to your doctor early and go to an obstetrician early. We have a problem with obstetricians because most of the specialists now, they only want to do gynae and they don't want to do obstetrics, but you have to find an obstetric doctor and do it. Now, as South African Society for Obstetricians and Gynecologists, we have put out what is called a standard of care, and it's called Better OBS, and we are trying to get everybody to follow it. Now, if you think about 37 years ago when I started practice, it was primitive. What we did, we just saw people as they came and we managed problems when they came.
Yes.
Now, antenatal care and pregnancy has gone sophisticated. You are in a mode of prevention, prediction, management, and prevention of complications that are taking place. The whole idea now is not to wait for problems to happen, but to predict when they're going to happen and to prevent them. Now, the standard of care has changed a great deal. First thing, let's start, if you fall pregnant, it's not just to wait to 3 months, because when you fall pregnant, at as early as 6 to 9 weeks, we can do tests for you to check if you are at risk of a miscarriage and try to prevent the miscarriage. You got a MU6 model. Everything is now on an app. If you just put it on your app and you look at it and you look at your beta HCG levels and the progesterone levels, it will tell you whether your pregnancy is going to grow or not. And if you feel it's not going to grow properly, and if you get any bleeding in between. Before this, when the patient got bleeding, they said, come back again. Now you can give things like progesterone, cyclogest, utrogestan, and you can prevent miscarriages. I had a lady, she had 9 miscarriages, but she came to us again. We put through the program, and now she has got a baby which is 18 months old. She's over the moon.
So
it shows you
we
what you can do.
that bad obstetric history.
Yeah.
And the tendency is, I'm even thinking about someone who's got a cervical incompetence. We only make the diagnosis maybe on the 4th pregnancy.
So that's why I'm saying at that first visit, and we must say that the Department of Health has now put up a nice handbook, but we have to get the nurses and the midwives to accept it. Now, the standard of care is that when you go for the first visit, it's supposed to be, the first visit is supposed to be a point of care comprehensive visit. They're supposed to check your general health status, height, weight, your blood pressure, check your risk for diabetes, what is your risk for getting PET, checking and doing the tests immediately. The tests that we will do, urine test, syphilis test, HIV test, blood group, because blood group is important, especially if you had a blood transfusion or if you've got a Rh negative blood group. People forget this. You have a miscarriage. They never checked whether if you are Rh negative, whether you are sensitized.
And then the next thing pregnancy.
You are in catastrophe. So you need to look at Rh antibodies and things like that. Look at your rubella status, look at this. Now if you look at antenatal care, we are giving out the mother book, and if you look at all those things, they have to tick it, because we are checking all these things before that. So in the standard of care, this is there at immediately. Now at 13 weeks, you should, now this is where the government does not have scans, and they're not doing the 13-week checkups. But if you stay in Nelson Mandela Bay, you are very, very lucky as compared to the rest of the country, because in Nelson Mandela Bay, in Port Elizabeth area, we have a radiographer. Her name is Renee Kuhn. She's got a scan van, and she is doing scans, 13 weeks and 20 week scans for 500 rands, which if you go normally, it costs you about 2,000 rands, but she's doing it for the community, to help the community.
That's awesome.
And if you go to the clinic and the clinic gives you a voucher, she's only going to charge you 300 rands.
Oh.
Now, if you are in Utnake...
So the service is available even to clinics?
Yes. If you're in Utnake, Any clinic you go in Utnik, if they give you a voucher and they say go to Dr. Pillay, we only charge you 300 rands and we do that. And at 13 weeks, we can check for Down syndrome, we can check for Edwards syndrome, we can check for Padau syndrome. And these are not just checking. They are 95% accurate for Edwards syndrome, 95% accurate for Padau syndrome, 99.5% accurate for Down syndrome. You can look for acrania. You can, so all of
Down
these things.
syndrome is so common now. We used to say advanced maternal age, but now it's even young mothers.
No, that's a false thinking, because you see, if you take the graph, the number of people that are in the younger age group is more. So therefore, you have to check for Down syndrome because you pick up more. Do you know what a burden it is to have a Down syndrome child and take care of the child? They live to a long time and they have to have full-time care after that, and it's a burden to a family. So those things can be checked. Now, two things that I want to emphasize here at a 13-week scan. By a 13-week scan, if you just do uterine artery Dopplers, check the blood pressure, check the weight, and check the biophysical things of the mother, we can predict to 95% which mother is going to get PET. Just check the history. If she has got high blood pressure, chronic disease, if her mother had a PET, there's an algorithm and an app. You put this information in that. It's a FMF Foundation. It's free software. Anybody can download it. You can predict to 95% that this person is going to get PET at 28 weeks. And you can just give half a aspirin, which is the cheapest drug you can buy. Half a aspirin at any time, once at night, 236, and you can shift the curve to the right, and you can prevent and push PET. PET is the biggest killer in pregnancy, and you can look at it. Now, if you got a mother who's got a high BMI, if you look at the baby that is growing bigger than what is supposed to be, if you got more water inside, then you do a simple standard test for diabetes. You give 75 grams of glucose to the mother, check the glucose 1 hour, check it after 2 hours, and look at it, and you'll tell this mother she is diabetic or not. Please don't tell the mother you have gestational diabetes, Lento, it's only during your pregnancy. Every gestational diabetes mother is going to become diabetic sometime, so you better use that opportunity to change their lifestyle to prevent diabetes.
Because you are diabetic.
You are diabetic already. The same thing if you get PET. If you get PET, your chances to get a heart attack and heart complications later in life is 60% more. So if I can prevent PET, I'm not only preventing the baby from becoming an arm, I'm making the mother healthy, so I'm protecting the mother. So that's a standard for 13-week scan. And then at 20 weeks, you check, according to ISIO guidelines, 20+2, we check the brains, we look at all the parts of the brains. I don't want to confuse people, but
before you check the brain and hydrocephalus, we're going to take a short break. You are not confusing them. You are touching on nice points, because that is why these things are important. Because if you pick this thing now, then you can talk to them and go, this is what is happening with your baby. The chances of the baby being fine are like this, and the chances of baby having a congenital abnormality are like this. But we'll be back shortly. Thank you so much for talking antenatal screening, the importance of screening before you fall pregnant and also during pregnancy. Which tests are done and why? Which medications are altered and changed and why? Most medications are not safe during pregnancy. That is why you need, at the planning stage, to have everything sorted out. We'll be back shortly. Welcome back. We're talking pre and antenatal care. That is taking care of yourself when you're planning to fall pregnant and also during pregnancy. It's a journey. The person who donated the sperm and the person who donated the egg, they journey together from planning until the journey is complete through the eyes and brain of our senior colleague, Dr. Siva Pillay, who's so deep into obstetrics. He's done a lot of work and is doing a lot of work privately and also in the public sector. Thank you so much for the hard work that we're doing. We've saved so many souls and produced so many babies. Thank you for educating the nation. I'm sure people will actually locate you for everything that you do. It's not in vain. Can you just give us the last bombs?
I want to say now, in terms of antenatal care now, people must not just think that it's only in the private sector this is there. The government is doing quite a lot, but sometimes, things fall through the crack. So if we empower mothers to say, when you go to the clinic, go early. 2, ask the sister to give you a mother book. Make sure that they don't just give you the mother book, they start filling in the mother book, because when you fill in the mother book, that means you are doing everything that needs to be done. Make sure that your tests are done. Go for your results and come back. If you are living in Port Elizabeth area, it is really sad that our patients can go to delivery to deliver your baby and you have not even had a single scan. So in Port Elizabeth area, we have got people that are community orientated. If you are in PE, talk to your sister in the clinic and say to your sister in the clinic, give you a voucher so that you can go and see Rene Dubel or Rene Kuhn in a scan van. If you are in Utne, you can come and see us. And at 300 rands, we will do the 13 and 20-week scan. The 20-week scan is so important because we look at the brain, we look at the heart, we look at the lungs, we look at the kidneys. We can see so many things. And at 20 weeks, we can then tell you your baby is okay or not. Because can you imagine a baby whose heart is not proper? Can you imagine a baby whose brain is not proper? And the mother is carrying that pregnancy, and only
And
at
yet you've
35,
got now
36,
time to prepare the mother. Don't be surprised at birth. This is what is going to happen.
Not only that, we have saved babies. You see, even in Doranginza, we found a baby with transposed vessels. We found a baby with VSD. But it's so important that if we know beforehand that this is a condition, you deliver that baby in ICU, you put the patient on ECMO, put the patient on treatment, you can save it. Sometimes we have exophthalmos, okay, it's where the bowel is outside the body. It's so easy to make sure that that baby is delivered properly, exophthalmos.
Sure.
And you protect that bowel and you can make sure that the baby is there. If you look at the baby and you see the bladder is big because there's an obstruction, as soon as the baby is born, don't wait that the baby has not passed urine.
Okay.
Immediately catheterize that baby, send that baby for relief of the obstruction, you will protect the kidneys. So those are things that you can do in a 20-week scan. And then you should have a scan or an evaluation at 37 weeks, 36, 37 weeks. That there prepares you to delivery. So you examine the person to see, can this person deliver normally?
Yes.
Can this person deliver by Caesar? Who needs to do what? And how do you plan your pregnancy? Then you educate the person also, what is labor pains, how is labor pains, and to lungisa onke into so that you have your transport and everything ready so that at the time when it's coming, it's not our pitizela ngapha.
On the mode of delivery, Siva, I'm just trying to think what questions people would ask you. On the mode of delivery, there's a tendency for people to shift towards cesarean section now. Is it true that we're doing cesarean sections unnecessarily? That's one.
I don't think that we are doing it unnecessarily. I think that people are scared of litigation and they're scared of complications. So if you do a vaginal delivery, it is safer for the mother, but the child goes to a stress. But if you do a cesarean section, it's not safer for the mother because the mother can get complications. You're doing a big operation, but it's safer for the baby, and then, so only if the baby is under stress, it's got diabetes, if the baby is small, the water is less, or the big thing now is happening with the junk food that we are eating is making big babies. And now you've got really babies that are over 4 kgs. So mothers cannot deliver. Now they will tell you, no, but I've delivered before. Yes, but you were not eating that junk food before.
Yes.
Now you've become a little bit richer in your life, so you buy Kentucky and the other things more. And this really creates a problem about the food that you eat and the bigger babies that you have. But having said that, you need to do an evaluation, and I would say yes, there is an increased risk of people doing this thing. Now we are having a new problem, and this problem must be known. It's called scar pregnancy. If you get a scar pregnancy, 80% you are not going to live as a mother. When the next pregnancy gets stuck where we cut you, the placenta grows through the scar, it goes into the bladder, it goes into everywhere. It's called placenta accreta syndrome. Patients can bleed 10, 15 liters of blood. For those patients, we don't even do a scar. We take out the baby from the back, we take out the uterus. If you try to take out the placenta or anything, you're going to end up in a dead mother. And so that is becoming an issue. So now that one more thing that we have to do at 8 to 13 weeks is to check in any mother that has had a previous cesarean section, where is the placenta? If the placenta is in the lower anterior segment, be careful of a scar implantation because it's a huge problem and 80% results in death.
Just because of time pressures, do we still do trial of scar? Someone who's got a Caesar, do they have a chance to deliver naturally if they want?
VBAC, that is vaginal birth after...
Just touch on the issue of sex during pregnancy. Can people
VBAC is vaginal birth after cesarean section. It must be done. If you do VBAC, remember, somebody must be there monitoring you and your labor. This is the problem that we have. We don't have enough staff and things like that. So somebody must monitor and check, because when you do VBAC, you must have a theater ready.
Yes.
Because in case it's not going good, if the uterus ruptures, anything happens, then you move over. Second thing, sex during pregnancy after 12 weeks. If there is a risk of miscarriage, we tell them to abstain for that time. But after 12 weeks, sex during pregnancy is absolutely safe. The progesterone levels are high, your placenta has come in. So sex during pregnancy is
Unfortunately, the enemy is time. Thank you, Siva. Thank you so much. I appreciate you. Thank you to all our viewers. Dr. Siva Pillay, we'll make sure that we invite him next time. There's a lot of chapters and chapters to cover to make sure that, in fact, South Africa, we are saving South Africa. If we can take care of our mothers, pregnant mothers, in preparation, during pregnancy, and after pregnancy, the outcomes will improve. Maternal deaths will actually decline, and infant mortality will actually decline, and then we're going to solve the country. Thank you so much. Follow us at Pillay Communications, Pomakapa TV, on all socials. Thank you so much. Siva, well done.
Thank you.